Okay, we're going live. Going live with Are We De-Escalating Too Much? We'll give it a moment for all the streams to populate. Hope everyone's doing well. Getting a great start to their week here, April 28th, Monday, 2:30 Pacific Standard Time. Are we de-escalating too much? An interesting topic. We're also doing some technical testing today with this ability to populate all the platforms simultaneously. I hope it's working. And if you're joining us now, welcome. I'm excited to have this conversation with you. And great. Okay, I'm getting some messaging now from our administrative support that it looks like it's working on some of the platforms already. Great news. I hope you join us. Please come on in. Welcome. We're going to talk about an interesting subject that came up over the weekend. I had an opportunity to witness on Instagram, it was, an interview between a couple of public safety professionals that were speaking to a phenomena that we're observing in the public safety space. And in particular, what that means is a responder, particularly uniformed responder, investing a great deal of time in what is being described as de-escalation. We'll talk about that in a minute. But they're investing a great deal of time in having a conversation with a subject, a person served, any number of titles you can give to the person on the other side of the conversation. And the phenomena is that during the course of the conversation, the dialogue, and of course, someone is pretty animated or agitated in how they're expressing themselves to the officer. There's criticism of the safety practices of the officer, and there's criticism of what they're doing and how it's reducing safety and increasing risk. And then there's generally some presentation when presentation about the encounter becoming physical, violent, and then the phenomena is described as: are we de-escalating too much? Are we emphasizing so much de-escalation that people are getting hurt? So I'd like to talk a little bit about that and get to the bottom of that question. Let me take a moment and just see. Okay. No Instagram, but I'm on Facebook and YouTube. So we solved the YouTube problem. That's good. Just keep working on the Instagram piece. Check out LinkedIn also, if you would. So let's get to the bottom of that. What's at the core of that supposition is that de-escalation training is conditioning someone to ignore safety cues that would, generally speaking, instigate other modes of engagement that improve safety margins and reduce risk. And instead, someone is incurring more risk by engaging in de-escalation. I've been in this game for some time, and I'm going to render some opinions that are a product of that experience over time. You don't have to agree with them. I'm just going to tell you what I've come to conclude and what I've seen and where I think we really need to set to work. Initiatives that emphasize preventative measures during a crisis. For instance, we're going to restrain in the name of safety. We're going to engage physically with someone in the name of safety. We're going to restrict them from liberty or movement in the name of safety. By and large, I have seen that wildly abused and subject to very little procedural um, oversight, particularly after the event. We have review boards for the use of lethal force. We don't have review boards for these other areas of engagement where we're appraising de-escalation quality and assessing if someone was even doing something that was de-escalatory in nature. Meanwhile, we're calling it de-escalation, and as a result, de-escalation isn't working, or as a result, de-escalation is not effective when there's no standards to review that, and someone is just opining that. This is unfortunate. Um, I had the privilege of working with a um, command level officer in a police agency who was pioneering essentially a de-escalation review instrument. Uh, Following body cam footage, can someone properly appraise that the de-escalation training, whatever it was that the officer took, was properly administered, properly used before an event became physical. So I think of my colleague and brother, Tony Blauer, on a couple of chief principles when it comes to events like this. And he expresses it in a particular way. I'm going to express it a little differently, but the other person, the person who's animating themselves, controls the fight in the encounter, controls the resistance, controls the time, controls the amount of force necessary. The idea that someone served a subject, um, uh, perpetrator, whatever label you want to give the other person, depending upon the context, if they're presenting certain signs and people aren't transitioning or doing the appropriate things in response to that, whether it's violent or physical or transitions, I find it interesting that the claim can be made that apprehension or reticence is a product of de-escalation training. I don't know where the data is to support that. I do know that the FBI's data on negotiation um, value and outcomes is extraordinarily clear with respect to when these principles are properly used, it resolves an extraordinary number of incidents. Somewhere in the 90s percentile, I believe Gary Nesner told me recently in our latest discussion about the HOBUS data. The behavioral health data equally says the same kind of thing. When people engage in proper communication to reduce risk and activation of the other person's limbic system, the amount of incidents that become physical are reduced. We even see this in the longitudinal studies on the use of response teams that emphasize the use of de-escalation in psychiatric care and services. In the state of Pennsylvania, teams have been deployed that emphasize de-escalation to reduce episodes of seclusion and restraint in state hospitals. And that system hasn't used an episode of either of those in well over 10 years. I think it's closer to 13. So, no, I don't think we're de-escalating too much. I think we're crediting things that are simply in the verbal domain as de-escalation when they're not. Telling someone to back up, slow down, keep your hands where they are. These things, these commands, these kinds of examples, these are not de-escalatory in nature. There's something else. And I'm not criticizing them. There are times and places for all of those things. But we certainly want to be very careful about what we're describing as de-escalation. And that is a core lexicon vocabulary issue I really think we need to have a conversation about. What is de-escalation? What is de-escalatory? Hey, you need to stop talking that way right now or else. This is not de-escalatory in nature. This does not reduce activity of the limbic system in a human being. Anything that blocks a goal or violates an expectation is something that does stimulate the limbic system. And that's not my opinion. That's not an idea. This is something that is anchored solidly in psychology research, in neurobiology research. We have an extraordinary body of data around anger and aggression. And it's astonishing to me that when we say and do things that just by common sense, we don't like to hear when we hear them, we do them in the context of an interaction with someone. And we're calling it de-escalation because it's verbal, because we haven't resorted to putting hands on the person yet. Public safety does not have the market cornered on this phenomena, by the way. Don't think for 1 minute that hospital staff, emergency medical services staff, psychiatric care and services staff, residential treatment facility staff, corrections officers in both jail and prison don't suffer the same situation. We say and do things that are verbal in nature. We don't really appraise it other than call it de-escalation. Okay, great. Thank you, Jess. We call it de-escalation. And then upon any learned or expert level appraisal, what we're observing is that the person involved in that activity is engaging in the use of statements. Okay, got it, Jess. Thank you. Is engaging in the use of statements that are completely incendiary or inflammatory in nature. And we're wondering why people become animated or angry or resort to violent behavior. This happens with psychiatrists, well-meaning physicians, incredibly educated, paid an extraordinary amount of money, saying absolutely incendiary things to someone 3 times their size living with schizophrenia and characterological disorder. And then when the person comes across the room at them and wants to take their head off, and we have to get in between that person served and the psychiatrist is saying that my de-escalation failed about himself. Well, you didn't say anything de-escalatory. You were telling him that he only had 3 choices. He had to pick one, and he had 5 seconds to do it. So he's now feeling time crunched, where he has no control, probably feeling shame over it. And so he wanted to give you a shiner. Why is that surprising to you, doctor? You know, we do things like this all the time. We do it as parents. So no, I don't think we're de-escalating too much. I think we're doing things that are being described as de-escalation, and they're not. So this live was to serve a couple of purposes. First, it was to come on here on an impromptu basis and test the technology. And I'm really thrilled that from one platform, we're streaming to all of our social media accounts. This is wonderful, Jess. Thank you. And thank you for our team that worked hard on solving this. Secondly, was to talk about this in a timely way, because I would like to be a voice amidst a growing, what seems to be decrying of, we're emphasizing too much de-escalation and soft skill. We need to go back to hard skill. And even that lexicon is poor. Hard skill being physical, force-oriented, soft skill being verbal. Let me give you a quote from one of the more visible force users in the firearms space. He frequently references this quote by Herodotus. Force has no place where there is need of skill. How do you know that you need skill? You need to review these events and determine if skill was used or not. Telling someone to shut up, knock it off, back up or else, these are not de-escalatory in nature. And this doesn't mean there aren't times that they're not supposed to be said. I'm not saying that at all. And I've certainly had to say and do those things more times than I can count. More hair I have on my head, and I'm losing it, but I had more hair some years ago. The point being, we're getting too casual with this idea that talking to someone and trying to understand them, even if it looks heartfelt, is automatically de-escalation, when upon more careful appraisal, we're hearing things like an extraordinary amount of open-ended questions when someone is not in a space to receive open-ended questions. Consequently, they feel pressured. Consequently, they become more animated in how they express themselves. And we call that de-escalation failure. This is nonsense of the highest order. In de-escalation, we try not to use too many open-ended questions because we want to, in the words of the great Andy McDonald, reduce stimulation so that, in polyvagal theory, Dr. Stephen Porges, we can emphasize wider diversity of thought and expression. When you do things that pressure someone, their ability to think complexly reduces. Not my invention. So if you say and do things from high arousal, and I'm not saying there aren't times where we may not be required to say things from high arousal. You may have to be presenting a firearm based on a safety condition that was observed immediately upon entering, and then go into a compressed low ready, splashing white light, and then engage in verbal de-escalation while having that present. I'm not insensitive to this. Of course I am. But if you start saying and doing things to control the situation, don't call that de-escalation. That's not de-escalating. Now, you may think it is because, well, I'm establishing control of the scene. Well, you're establishing control of the scene. That needs to happen first. Then we can de-escalate. But let's not call things de-escalation that aren't de-escalation. And I and some others are deep in the weeds on trying to develop some standards on this across sectors because we have very little. And we have law about it. We have policy about it. Best practices standards? Nah, we don't have that. And someone who says that we do, I'd love to see that. I'd love to see how you're appraising each and every interaction that your workforce members and the quality of those interactions that you're engaging in with people served. Now, there are some agencies that are pushing the envelope on this, and out in Eastern Washington is one of them. Measuring social interactions, which I think is terrific. And we are definitely on a continuum of improvement. But let's be clear. Are we de-escalating too much? And is the emphasis on de-escalation training detracting from safety? Not in my opinion, because we can't even put our finger on what the hell the person who has been trained is doing at the time of the incident. And we're not appraising the quality of that in any meaningful way, at least in my opinion. Now, if someone is, great. I'm not aware of it. And I do know that there are some agencies that are getting serious about this. They're getting serious about using AI. They're getting serious about reviewing these kinds of things. But to the extent that they're applying standardized appraisal of the qualities of interaction in between responder and person served, that's not mainstream at all. And it needs to be. So with that, it's 2:47. I've been yapping for about 20 minutes. I hope some value has been derived out of this live. I hope you enjoyed it. I love doing these things, and I love that the tech is working, for God's sake. We've spent hours trying to figure this out. So anyway, all the best to all of you, and take good care. See you again soon.